In the mid-1880s, the back room of an Atlanta pharmacy smelled of alcohol, spices, and medicinal chemicals. John Stith Pemberton, a former Confederate cavalry officer, stood at a workbench cluttered with bottles and scales. A saber wound from 1865 still throbbed along his side, a permanent reminder of the Battle of Columbus. After the war, he had turned to morphine for relief, and the drug had slowly tightened its grip on him. Pemberton believed chemistry might free him from the very medicine he dispensed. He had already experimented with coca wine, inspired by European tonics that blended Bordeaux and coca leaves. Now, as concern about alcoholism and drug dependence grew, he searched for a gentler remedy. Into a glass he measured a dark, aromatic syrup, a blend of sugar, botanical extracts, and caffeine-rich cola nut, designed as a tonic for nerves, pain, and morphine withdrawal. When plain water touched the syrup, it created a murky mixture. But with the pharmacy's new soda fountain, carbonated water hissed into the glass, lifting the scent of citrus oils and spices. Pemberton labeled the concoction as a medicinal preparation and promoted it as a nerve tonic, a brain tonic, and a potential aid for those dependent on morphine or opium. On his handwritten labels, the name Coca Cola appeared not as a refreshment but as a hopeful cure. The story turned back to the spring of 1865, when John Stith Pemberton was known not for soft drinks, but as a respected Georgia pharmacist and Confederate cavalry officer. At the Battle of Columbus, one of the war's final clashes, he was gravely wounded by a saber or gunshot wound to the chest. Surgeons operated using the tools and knowledge of the time, and like countless injured veterans, they prescribed morphine for his unrelenting pain. In the devastated landscape of the post-Civil War South, morphine and opium flowed through pharmacies and doctors' bags. Medical journals and personal letters of the era described a growing dependence, quietly labeled the soldier's disease. Pemberton's own treatment followed that pattern. What began as legitimate pain relief slowly became habitual use. As the months and years passed, his reliance on narcotics deepened, mirroring a crisis spreading among former soldiers across the region. Yet Pemberton remained, above all, a chemist. Working in laboratories in Columbus and later Atlanta, he experimented with syrups, tonics, and so-called patent medicines that promised relief from pain and nervous exhaustion. Among them was Pemberton's French wine coca, a fortified wine infused with coca leaves. Period advertisements and drug catalogs showed it as a fashionable nerve tonic, foreshadowing why Pemberton would later combine coca and cola in a formula he hoped could ease narcotic dependence. Across Europe and the United States in the late 19th century, coca leaves and their derivatives were celebrated as marvels of modern science. Physicians, industrialists, and fashionable society praised coca preparations as invigorating, mood-lifting tonics. In this atmosphere, coca seemed less an exotic plant than a symbol of progress. Newspapers, medical tracts, and travel accounts repeated claims that Andean laborers drew tireless strength from chewing coca, reinforcing its image as a natural source of civilized energy. Nowhere was this enthusiasm more visible than in the success of Vin Mariani, a French coca wine created by Angelo Mariani. Advertisements showed famous admirers, including Pope Leo XIII and Thomas Edison, holding bottles or praising its restorative powers. Posters and magazine spreads presented coca as a sophisticated, health-giving ingredient, suited to clergy, artists, and intellectuals alike. Rather than a dangerous substance, coca appeared as a chic, modern tonic that promised vigor, clarity, and creative stamina. At the same time, medical journals of the 1870s and 1880s described cocaine, isolated from coca, as a promising local anesthetic and stimulant. Articles highlighted its usefulness in eye and nose surgery and its ability to banish fatigue or low spirits, while barely mentioning dependence or toxicity. Pharmacists marketed coca-based remedies for exhaustion, melancholia, and even opium habits. Observing these claims, John Pemberton believed that coca, blended with other botanicals, might ease morphine withdrawal and soothe what he called nervous affections. In Atlanta during 1884 and 1885, the story turned to a modest laboratory where a new French wine coca formula took shape. John Stith Pemberton adapted the popular European coca wines, blending coca leaf extract with Bordeaux wine, spices, and other botanicals. He labeled the result Pemberton's French wine coca and presented it not as a pleasure drink, but as a serious medicinal preparation targeting the exhausted and unwell. Surviving advertisements from that period revealed how boldly the tonic had been promoted. Newspaper notices and ornate trade cards proclaimed that Pemberton's French wine coca aided morphine and opium habits, soothed neurasthenia, and cured nervous prostration. Read aloud, their Victorian phrases promised renewed vitality, steadier nerves, and a gentler path away from narcotics, all couched in flowing script, decorative borders, and confident medical-sounding language that appealed to anxious customers. The recipe followed a distinct logic common in late 19th century medicine. It replaced a dangerous depressant, such as morphine, with a stimulating, supposedly harmless coca extract and a modest quantity of alcohol, implying that one drug could safely displace another. Pharmacies sold the mixture as a respectable tonic, while its creator consumed it himself, hoping to tame his own dependence. Behind each elegant label, the product carried very real, personal stakes. In Atlanta, the temperance movement had gathered strength, and public pressure against alcohol mounted each year. By 1885, Fulton County's push toward prohibition threatened every wine-based tonic sold in the city. French wine coca, once marketed as a genteel remedy, suddenly faced legal uncertainty. Faced with the likely loss of his livelihood, John Pemberton searched for a way to preserve his coca-based formula without the alcohol that now attracted scrutiny. Pemberton turned to his laboratory, where formula notes later showed a decisive shift. He removed the wine base and substituted a thick sugar syrup, keeping coca leaf extract while adding cola nut for its caffeine. Citrus oils, vanilla, and spice flavorings rounded out the mixture, aiming to mimic the complexity once provided by alcohol. The result remained a medicinal tonic on paper, designed for nerves, exhaustion, and supposed withdrawal, only now legally alcohol-free. In 1886, at Jacob's Pharmacy in downtown Atlanta, this new coca syrup met an unexpected twist. When a portion was prepared for a customer, it was reportedly mixed with carbonated water instead of plain water, either by mistake or quick improvisation at the soda fountain. The pharmacist on duty, Willis Venable, tasted the fizzy mixture and recognized its appeal. What began as a workaround for alcohol laws had suddenly become a promising soda fountain beverage. The name Coca Cola had already hinted at its botanical roots, coca leaves and cola nuts. In Atlanta, period invoices, formula books, and advertisements revealed how the new drink moved from pharmacy counter-experiment to branded product. John Pemberton and his bookkeeper, Frank Robinson, shaped a distinctive identity, with Robinson's flowing script logo and carefully chosen wording. It positioned Coca-Cola not merely as a refreshment, but as a preparation emerging from the world of medicine. Surviving promotional leaflets and newspaper notices described Coca-Cola as a valuable brain tonic and remedy for headaches, exhaustion, and nervous affections. Some early copies spoke to those suffering from opiate habits, promising support for frayed nerves and lingering withdrawal. These claims placed the drink squarely within the booming market of patent medicines, where tonics, elixirs, and syrups offered relief from addiction, anxiety, and chronic fatigue in an era before regulated pharmaceuticals. Careful comparison of original documents showed that later legends often exaggerated Coca-Cola's role as a cure-all. Yet one fact remained. The original formula did contain a small amount of cocaine from coca leaves, along with caffeine from cola. At soda fountains in the 1880s, the mixture functioned as a temperance drink, non-alcoholic but psychoactive. Middle-class patrons sought it as a fashionable way to ease tiredness, calm worries, and soften the after-effects of more dangerous drugs. In the late 1880s, Coca-Cola slipped from the back room of a single Atlanta pharmacy into a wider commercial world. Asa Griggs Candler, a rising businessman, quietly gathered promissory notes, contracts, and partial interests in the drink. Surviving financial documents showed a pattern of incremental purchases beginning around 1887 as John Pemberton's health worsened. Each new agreement moved control of the mysterious formula closer to Candler, even while the public still associated it with its original inventor. Pemberton, suffering chronic pain and long-standing morphine dependence, repeatedly exchanged slices of his Coca-Cola rights for much-needed cash. Testimonies and later recollections suggested he remained addicted until his death in 1888. As he weakened, his legal and financial position fragmented. Different stakeholders briefly claimed overlapping interests in the formula and name, but Candler's organized approach, backed by carefully preserved contracts and receipts, steadily consolidated ownership in his favor after Pemberton's passing. Under Candler's direction, the drink's image shifted. While Coca Cola still appeared in pharmacy listings as a nerve tonic and specific for headaches, some advertisements now leaned less on explicit medical promises and more on energy, vigor, and everyday refreshment. The formula, still containing coca derivatives and caffeine, retained a distinct pharmacological kick. Business ledgers and early posters captured this transition. As a remedy for withdrawal and malaise evolved into a broadly appealing soda fountain beverage. By the late 19th century, medical enthusiasm for cocaine had begun to fade. Clinical case reports described patients who could not stop using the drug, suffering paranoia, hallucinations, and physical collapse. Around the same time, newspapers discovered the topic, printing lurid accounts of so-called cocaine fiends lurking in cities and company towns. What had once been hailed as a modern miracle drug slowly turned, in the public imagination, into a sinister and destabilizing substance. This changing mood collided with a larger crusade against patent medicines. Reformers and journalists exposed how popular tonics and elixirs hid alcohol, morphine, and cocaine behind vague labels like soothing syrup or nerve tonic. Their investigations helped spur the 1906 Pure Food and Drug Act, which demanded accurate ingredient labeling and empowered federal inspectors. Overnight, countless bottles on drugstore shelves, once marketed as harmless restoratives, were reclassified as potentially dangerous chemical cocktails. Within this new regulatory and moral landscape, Coca Cola came under scrutiny. Its historic use of coca and caffeine invited questions about whether it remained a disguised stimulant rather than a simple refreshment. Although the company had already removed the psychoactive cocaine alkaloid, relying instead on so-called decocainized coca leaves, federal officials pressed the issue. The famous 1909 to 1911 case, United States vs. 40 barrels and 20 kegs of Coca Cola, forced the former drug cure to defend itself in court as an ordinary soft drink. By the late 19th century, medicine sat at an uneasy crossroads. Doctors and chemists still experimented with powerful new substances, yet growing scrutiny questioned the wisdom of treating one addiction with another stimulant. Cocaine had been praised as a remedy for alcoholism and opium dependence, while morphine itself had once been hailed as a solution to alcohol abuse. Gradually, medical journals and reformers warned that such cures merely shifted dependence rather than resolving it. Within this climate, Coca-Cola's early coca and caffeine formula fit a familiar pattern. It echoed other commercial preparations marketed as tonics, nerve restoratives, or temperance drinks that promised relief from withdrawal, fatigue, or melancholy. At the same time, pharmaceutical firms promoted heroin as a supposedly non-addictive alternative to morphine, and cocaine-based products claimed to strengthen the will against habitual drinking. Later psychiatric and pharmacological analyses showed these interventions mostly dulled cravings or masked symptoms, leaving the underlying vulnerabilities untouched. As regulation tightened in the early 20th century, many patent medicines vanished or were reformulated under pressure from laws such as the Pure Food and Drugs Act. Coca Cola, however, survived by steadily abandoning medical language and distancing itself from therapeutic claims, evolving into a branded refreshment rather than a remedy. Its transformation captured a broader shift. Narcotics became objects of legal control and clinical concern, while consumer culture absorbed former quasi-pharmaceuticals as everyday products, carefully stripped of the word cure. By the early 20th century, Coca Cola had fully shed its pharmacy counter identity and entered the age of mass production. Bottling plants and clattering conveyor belts turned a once local remedy into an industrial product. Advertising campaigns no longer mentioned nerves, fatigue, or tonics. They promised only refreshment. As exports spread across the Americas, Europe, and beyond, few consumers knew that the drink had begun as an experimental answer to morphine withdrawal. During World War II, Coca Cola followed soldiers overseas, its bottling plants installed near battlefronts at the insistence of top company leadership and with support from U.S. authorities. The drink became intertwined with American identity, appearing in newsreels and photographs from North Africa to the Pacific. In the Cold War, it stood as a symbol of Western consumer culture, rivaled by Pepsi in famous marketing pushes. Behind these global images, the original medicinal recipe remained a fading curiosity. Regulation had steadily pushed the formula away from explicit drug associations. Cocaine was removed in the early 20th century, alcohol had long since vanished, and modern quality controls replaced the informal mixing of patent medicine days. Contemporary science understood addiction as a complex brain and social disorder, making the 19th century practice of substituting one intoxicant for another seem naive. Yet the paradox endured. A worldwide symbol of harmless refreshment had started as a serious, misguided treatment for drug dependence.